Hi and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. So in this video we're going to be looking at the part 3 in the pain and dissociation series. So the other two have been looking at how pain can be manifested through either complex trauma or through dissociation, how pain might be being held or acts as a communication to try and resolve things. And in this part 3 video we're going to be looking at something much more specific to dissociative identity disorder. So this is less relevant for OSDD, but it can still happen. So for DID, this is what we're going to be looking at here. It's how pain is related to the specific transition or switching or fronting through which alters sort of come to the fore and take over the body, take over the behaviour or speech, manifestations of behaviour, things like that. So we know that the SCID, the Structured Clinical Interview for Dissociative Disorders, we know that that has elements of understanding and trying to track this within that process. So we know that this is something that happens. I've seen this manifested within clinical settings, and it's something I just wanted to go through today to try and help understand sort of a third or different type of pain, how that can form and how that can be seen within the process of a person experiencing DID. And while I think this is less frequent, so I think the other forms of pain are much more common, it can be extremely distressing. And the experience that I've had working with people in clinical settings, when this type of pain occurs, it's very, very troubling and upsetting for people. And the good news is that there's a lot that can be done about this. This is actually probably easier to solve than the other ones. I say easier. It can be quite a complex process for a person to get their head around, but actually the method of it is fairly simple therapeutically. And the premise behind this form of pain, this form of experience of pain within DID, is that it's a painful process that takes place when an alter or part switches or comes to the front. So we're thinking about, say, let's say a very obvious, so there's a person, they have DID and they have alters to sit behind the scenes, and from time to time or whatever it is caused, all those alters come to the front and they push forwards and they take over the behaviour or the speech, and they're in control of things. And the pain occurs after that. So it doesn't occur during that, it occurs after that. And that's what gives us the hint. So it's not like a painful injury that's taken place, it's a consequence of that switch, of that movement of the parts from the behind coming forward towards that person. And the way that we've understood this within the clinic is that it's the movement coming forward is what causes the pain. So we tend to think in a way that a lot of people who block or suppress or deny the presence of alters, when this switching occurs, they are left with a series of symptoms when they return. Now, those symptoms can be all sorts of different things. It can be a sense of unease, or they can get the echo of the emotion that's being felt. They can feel sick, they can feel tired, all of those things. And one of the symptoms, one of the things that happens almost like a side effect of the switching process is pain. So as an example, I've worked with people where following a dissociative event, a switching that's taken place, alters moving forward, that they have not wanted to happen. They've denied the reality or the experience of DID. After they come back, when this process has happened, they are left with intense pain. And that pain can be in various different places in the body. For example, it can be head pain like migraines, or it can be stiffness, it can be pain in the stomach. But there is something that has told them that something has happened. So they weren't in pain before, there's been a dissociative event, and then they're in pain. So we look at it that's a cause and effect type relationship, that the movement of the alter coming forward has led to pain in that individual. I don't tend to see it that much where the movement is an easy process, where the part is welcomed or is fully understood, or someone is bringing them forward. So they might reach in, they might look for a part, check in, find that part wants to come forward, the person's happy with that, the part comes forward, and actions take place. Very few symptoms, very few sort of physical consequences of that at all. But in people where it's not wanted, or it's denied, or it's suppressed in some form, it's almost like there's a forcing through that alter has to take in order to be seen or to be heard, and that causes pain along the way. And there you can see where the hint for how to change this is, because if there's a forcing through of that process, if the person fundamentally does not want that part to be out, And that can be many reasons. It could be that they're either in complete denial of the DID in the first place, or there's a lot of shame, or they're terrified about what that part might do. It might be a part that's not liked or wanted, or they might come out and chaos can take place, or they might say things or do things that cause intense shame and embarrassment to that individual. And therefore they try and keep it all away, but the part has an action system. It might be triggered, or it might just want to be seen, to be heard, to fulfill its role. And therefore you've got a conflict taking place. And in a way, back to the sort of the geology thing, the movement of the tectonic plates, you've got one that sort of stands still and one that's coming up against it, and it creates conflict. And that conflict creates the pain as one of a possible number of experiences that can take place in the physical realm. So when we look at this clinically, the therapy is around trying to guide that individual, that person, through to the process by which the transition from the alter, from behind to front, is done smoothly, easily, and then without any of the pain. So it's a very, very simple sounding process. Hey, just let the alter come through and chances are you won't end up with a massive migraine. But it's not really going to be as easy as that. So the therapy is built and is designed as part of the stabilisation process. Phase 1 of therapy with the guidelines that we work through. The phase 1 stabilisation is about trying to coordinate this action of the dissociative system. So if a person is able to have their parts moving forward and moving back by choice and is welcomed, and it's done on a smooth, easy transition, much less likely to end up having this pain. And this is exactly the experience that I've had working with folks in clinical settings, where when we start allowing the dissociation to take place, then the pain starts reducing, and it can happen almost immediately, which is really wonderful for the person, but they have to go through a sort of a series of cognitions and thought processes to allow that transition to take place. So realistically, what we're talking about is trying to change the system, trying to change the mind of the person to say they want the dissociation to happen rather than they don't want it to happen, and therefore the pain is removed. And that's a complex process. It's simple in terms of a person, if they change their mind and they accept it and they can move on, then all of that pain and all of those symptoms associated with this particular transition can almost reduce or disappear immediately, as I have seen happen, which is really wonderful experience for the person, but they have to buy into wanting this to happen, and that can take a long time. And the therapy is about trying to contain that and trying to help the person understand and give them techniques and give them skills by which they can allow this transition to take place safely by minimizing the fear, the anxiety, the embarrassment, the shame, and all of those things that have ordinarily been associated with that type of dissociation. So there we have it. There are 3 forms of pain that we see quite regularly in clinic. The first 2 described in the first 2 videos. This one is much more pertinent to DID in that it's about that movement from the behind to the front. And these all things can be resolved through the trauma process, through going through the phase treatment guidelines, understanding and accepting what the system is all about, what the trauma has meant, the impact and the processing of all of those things. So I hope this has been helpful. It's really nice doing one of these little mini series. Please do all the like, subscribing, sharing, all that kind of thing. And please leave the comments in the section below the video. We always do like reading those, and we take them on board and we sort of design some of our videos accordingly. So I hope, again, this has been helpful, and we'll get back to doing another video in due course. And between now and then, please do take great care.